For public laboratories, it's 3,800 pesos per test and 4,500 to 5,000 pesos for private laboratories. The Joint Administrative Order of the Health and Trade Departments says all costs are included, which means labs will not be allowed to charge more once this order takes effect. Before this, there have been reports that some laboratories or hospitals are offering 8,000 up to 12,000 pesos per test in exchange for a faster turnaround time. But there will still be out-of-pocket expenses here since PhilHealth only shoulders 3,409 pesos per COVID-19 test.
So meron ka out-of-pocket na 300 pesos. So, ganun na mangyayari. Pero hindi ka pwede lumampas sa 3,800. So, bali ang out-of-pocket na lang, 300 pesos. E mantayin mo naman, kung ginawan 10,000, tapos ang PhilHealth ay 3,500 lang, eh di 6,500 ang out-of-pocket mo. Kaya talagang maganda na meron po tayong ganitong polisiya.
We asked Secretary Duque, what about the labs that offer lower testing fees, since it could be confusing since the order says 4,500 is the minimum price for private laboratories. He just said that they are encouraged to keep their price low. Laboratories with overpriced fees will face a 15-day suspension and will pay 20,000 peso fine for first offense. For second offense, it will be a 30-day suspension, a 30,000 peso fine, and when caught for the third time, the lab's license to operate as COVID-19 testing facility will be revoked. This will take effect 15 days after publication, but we have no word yet when this will be published. Meanwhile, the government is studying the offer of suppliers or companies to use their walk-in freezer to store vaccines that would require a negative 70 to negative 80 degrees centigrade temperature. Health spokesperson Vergere didn't mention what the freezers are currently being used for. She also said the government is in talks with cold chain logistics companies should the government need ultra-low freezers. However, she clarified that nothing is final yet since each vaccine would have different logistical requirements. She also said the government's short-term goal is to import finished products instead of producing vaccines locally since the country needs them as soon as possible. Carolyn Bonquin, CNN Philippines.